It's Wednesday. Welcome to our Wednesday wellness tip. So today we're back to a physical tip. So I'd like to talk to you about adrenal and hormone health. I really believe that your thyroid, your hormones, and adrenals are like a three-legged stool. And they work interdependently with each other. Each one is important to our overall health. So one of the best ways that I've found to assess the adrenal and hormone is through Precision Analytical's Dutch test. Now this is a dried urine test, so it's very easy to collect because you literally just pee on a strip. And we get so much information from this test. So for instance, you are able to see all of the levels for your DHEA, which is the precursor to all of your hormones, such as testosterone, progesterone, and estrogen. And you're also able to see how well you are metabolizing estrogen, all three estrogens. And this is critically important because if you are not metabolizing estrogen normally, then those estrogens tend to recirculate in the body, and that's when we see signs of too much estrogen. So it's really critical that we're metabolizing estrogens normally. And if you are, then for instance, when you're postmenopausal, you would be a good candidate for hormone replacement. So this is very important information to get. We were able this year, in looking at these hormones, to find patterns, for instance, with PCOS, which is polycystic ovarian disease. And so when we identified those patterns, we were able to help balance those hormones naturally, which made a big difference in the patient's well-being. Also, we are able to get the adrenal information. So normally, your cortisol level, which is a reflection of your adrenals, normally your cortisol is going to be nice and low at night. This is what allows us to sleep good. And then when you wake up, you have a surge in that cortisol. And so it should go up normally. This is what gets us awake, out of bed, and ready to start our day. And then as we go through the day, the cortisol is going to decrease so that it's the lowest at night when you go to sleep. Now when we are stressed, and let me see, has anybody not been stressed this year? So when we have a lot of stress in our lives, sometimes this cortisol pattern can get out of balance. Have you ever known people who were tired and wired at night? They're very tired, very exhausted, but when they lay down, their eyes are wide open and they have a hard time getting to sleep. This could be because the cortisol is out of balance. So when we do this test, we can see that pattern. And if we see that, we can help give a supplement to balance that cortisol at night. Or for other people, if they've had a lot of stress chronically, then their poor adrenal gland may not even be able to produce cortisol. And so for those people, we give an adaptogen or a supplement to help produce more cortisol. So all of this is very important information, and we use this test a lot to help not just women but also men balance their hormones and adrenal function. So I hope that gives you some information to think about.